Medicare Parts A and B are very good foundational blocks of your healthcare and retirement, but supplement plans and advantage plans paired with them just don't cover everything like they're supposed to. Hello, and welcome to Building Blocks, a special health and retirement series. My name is Trey Basa, a licensed health insurance advisor with Market Medicare Advisors. Here on Building Blocks, I aim to build your foundational knowledge of everything Medicare, one block at a time. Today's focus will be entirely on ancillary products. This is where we'll talk about what those leftovers from Parts A, B, supplement plans and advantage plans and what they don't cover. If you are on Medicare, this episode is for you because if you pair everything that you have together, it's not going to be a comprehensive level of coverage that you intend it for. That's why these ancillary products come into play. We're going to talk about 4 building blocks to build your Medicare knowledge for retirement. And the first building block is going to be dental, vision, and hearing. Now, the big thing about this one is sometimes it's built in to the policy. Other times it isn't. Those 2 policies, supplement plans that you get from private insurance companies, they do not cover dental, vision, hearing. That's why we offer standalone dental, vision, hearing plans. But perhaps you're on a Medicare Advantage route. One of those perks, those benefits people often sign up for on Advantage plans is built-in dental, vision, and hearing at no additional cost. Now, the catch is this standalone plan is paired with the supplement plan, and you can apply for it anytime. You don't need to get it right as you are starting Medicare. In fact, a lot of clients often pick it up preparing for retirement versus right as they are signing up. So when we're taking a look at these dental, vision, hearing plans, a big thing about it is that major dental work has a 12-month waiting period. You have to be on the plan for 12 months before you get any coverage for major dental work. We're talking bridges, we're talking implants. These are things that are going to have to wait, and you need to plan to have that coverage well in advance. Additionally, the vision and hearing portion of these standalone plans, they usually have small allowances that help with your eye visits, your hearing exams, as well as hardware such as frames and lenses, hearing aids. One of the biggest catch to these dental, vision, hearing plans is that they promise X amount in benefit and you get X amount in coverage. You get more coverage than what you're paying into it, but how you're using it can deplete often in one sector more fast than another sector. When we're taking a look at dental, vision, hearing plans, you get more benefit out of it, but you need to plan to use it accordingly. So perhaps one year you have a lot of dental work, and that can take away what you're using for, say, frames and lenses, a change in prescription, or maybe you're heavy on hearing aids. You need a new pair of hearing aids, and that's going to eat up a lot of your benefit for that year. And you have to wait until January 1 of the preceding year in order for that to restart. Our next building block is going to be paired with Medicare Advantage plans. This building block, this policy, is called hospital indemnity plans. Medicare Advantage plans are promising $0 a month if you operate within network. And in that network, you have co-payments for services you get rendered when you get them rendered. So really, you're only paying for what you use. The biggest co-payment on any Medicare Advantage plan is always going to be the hospital stay. You have a few $100s for the first 5 days in the hospital. You're paying hundreds of dollars for those days, and that can add up fast. Where the hospital indemnity plan comes into play, in exchange for a monthly premium, you will always have your hospital indemnity plan pay for your hospital co-payments. So you're paying, again, so much in monthly premiums for so much in benefit. Now, the question is, when are you going to be in the hospital? As we were talking with Taylor Bevan from Market Tax Services in our previous episode, it is best to have these policies and not need them versus need them and not have them. These are, in essence, insurance policies to where you don't want to have to use them, but you're going to be glad that you did. Now, last note on Medicare Advantage plans and hospital indemnity plans, you will have these co-payments paid for by your hospital indemnity plan. Whatever copayments are covered are going to go towards your maximum out of pocket on the Advantage plan. So now you're spending so much to get X amount covered that goes to your maximum annual out of pocket costs. It adds up, and you're going to be glad that you had this policy when you actually need it. Our next building block is going to be the last episode that we just dived into with Taylor Bevan, the cancer, heart attack, and stroke policy. Again, this is a policy that you can apply for at any time, but you are going to have to go through underwriting. It goes to note that we often encourage this with both supplement plans and Advantage plans. Cancer, heart attacks, strokes, they don't discern who they're coming for. They can hit anyone, anywhere, anytime. So it's important to understand that you'll have to go through underwriting. You have to plan to budget for this monthly premium on a separate policy. And if anything were to ever happen, just know that this policy's got your back. It's got a one-time payout of X amount of dollars. What that benefit could be anywhere from $5,000 to a $75,000 one-time payout upon first incident, first diagnosis of cancer. That money is meant to help you with those indirect costs for all of those different treatments. The supplement plan, the Advantage plan, they will cover major medical episodes like cancer, heart attack, stroke. But like we were talking about in our previous episode with Taylor, there's going to be a lot of indirect costs that people don't often account for. Transportation to and from hospitals, meetings, perhaps lodging if your specialist is in another city, another state. And however long it takes for those things to actually transpire and resolve, you're going to be glad that you had a policy to take care of you in this desperate time of need, in this very emotional time. Our last building block is going to be something that we often talk with our estate planning attorneys here at the firm. We bring them into the conversation because this is something that people don't often plan for. But again, they're going to be glad that they got this policy. It's the final expenses policy. Now, a lot of people are planning for end-of-life care, but they are neglecting end-of-life processions or a lot of different things that add up that often are passed on to their next of kin. Burial plots, receptions, coffins, those costs, they add up. And by golly, if you haven't planned for them, your next of kin has to plan for them. So this final expense policy, again, is going to be a one-time payout. That benefit that is paying out is going to determine your monthly premium. And you pay into this policy to get that benefit at the time that it is actually called on. You wouldn't want to pass along any of these extra burdens like finding and paying for a burial plot or the reception, the coffin, and things like that. I know it's a morbid subject, but it's important to have these plans put in place. Otherwise, you are passing the baton on to your next of kin for them to take care of. With these building blocks of information, we here at Market Medicare Advisors sift through all of these plans in your area to give you a better understanding of your grand plan for your healthcare and retirement. These ancillary products are often neglected if folks don't know about them and are usually picked up after the fact that they need a certain service or coverage. If you have any questions about ancillary products in general, or your policies, or you're curious if there's anything else better out there, please feel free to give us a call at 833-MAG-REPORT. That's 833-624-7376. Or you can email us at mail@marketmedicareadvisors.com and connect with us today. That's going to be a wrap for the episode. Be sure to subscribe to stay tuned for more videos just like this for all your Medicare needs. Don't forget to like and share so you can help your friends and family by getting them the information they need about their Medicare plans. You can also catch the show and our entire catalog of shows on our channel, youtube.com/Ancillary at Retirement Help, where we archive all our previously recorded and aired episodes where I and other retirement professionals come together in one place to talk about how we're actively working with clients today to prepare them to live their best lives in retirement. I've been your host, Trey Basa. Thank you so much for joining me here on Building Blocks, building your Medicare knowledge one block at a time. I'll see you guys in the next one.
Unless otherwise indicated, all client and prospect names mentioned on this show have been changed to protect the identities of the individuals discussed.
The content provided is intended for informational and educational purposes only. The views, statements, and opinions expressed herein are those of the individual speakers.
This is not endorsed or affiliated with any U.S. government agency, the Social Security Administration, or associated with any federal Medicare program. We do not offer every plan available in your area. Any information we provide is limited to those plans we do offer in your area. Please contact Medicare.gov or 1-800-MEDICARE to get information on all of your options.
Investment advisory services are offered through Foundations Investment Advisors LLC, an SEC-registered investment advisor. All rights reserved.